For Halloween, I'm dressing up as the scariest thing I can think of right now. Next year's health insurance premiums. In case you didn't know, health insurance costs are slated to go up significantly across the board. Even if you have an employer-sponsored health insurance plan, you can expect to see your premiums go up 15 to 25%. Deductibles are creeping up as well, and if you have a health insurance plan through the marketplace, you really need to buckle down. Unless the enhanced premium tax credits are renewed, many people, present company included, will see their health insurance costs more than double. One option is to switch to a less expensive plan, but that doesn't really exist. Even the lowest cost bronze plans may be more expensive next year than your family's current silver or gold plan. So a lot of people are thinking about canceling their insurance altogether and looking for alternative options such as health shares. But let's crunch the numbers and see if that's actually a viable cost-saving solution. My name is Dave, your self-employment sidekick, and this is a complex issue with lots of moving pieces and a lot of unknowns. I could spend this entire video qualifying and disclaiming everything I'm about to say, but I don't want to do that. You don't want me to do that. So let's just leave it at, this is for educational purposes only. This is not financial or medical or any kind of actual advice. I've just been spending a ludicrous amount of time trying to figure out the best options for myself and my family, and I want to share what I'm learning on the off chance someone else might find this helpful. I'm going to take a look at 3 different health share options: Christian Healthcare Ministries, Samaritan Ministries, and Unite Health Share Ministries. We're going to look at how they work, what they cost, and then throw a year's worth of medical expenses at them and see how they stack up against conventional insurance. Christian Healthcare Ministries and Samaritan Ministries are what I call traditional health sharing groups. Members pay a monthly contribution, and that gets distributed to other members to help pay for their medical expenses. If you have a medical need, you go to the doctor, the hospital, or urgent care and pay them directly for their services. And because you are a cash pay patient, you'll likely be offered a pretty nice discount, like sometimes 50% or more off the price you'd have to pay if you did have insurance. Because why? Why is it like that? Anyways, let's stay focused. You then send a copy of the bill to CHM or Samaritan, then you get reimbursed. How much you get reimbursed varies based on the plan you have. Let's start with Christian Healthcare Ministries. This is a pretty popular option. It gets pushed pretty hard by Dave Ramsey and his crew. CHM has a gold, silver, and bronze plan, as well as a plan for seniors. So let's look at the silver plan. There is a minimum amount to qualify per incident or illness, and that is $3,000. And the annual personal responsibility is $3,000. That means for any injury or illness that incurs over $3,000 in medical expenses, I can submit those bills, and CHM will reimburse the costs minus the $3,000 personal responsibility. It's essentially a deductible. On the gold plan, I would only need to pay $1,250 before CHM starts covering the costs. Some clarification on the minimum amount to qualify. Say I'm on the CHM Silver plan with a $3,000 threshold. I can't submit any expenses for an illness or injury until they reach the $3,000 mark. If I'm playing soccer with my boys and jack up my ankle pretty bad, I don't think it's broken, but I go to urgent care, get it checked out. They don't think it's broken either, and they send me back home with a boot and a bill for $500. I can't submit that expense. A week goes by, it's not getting better. My foot is turning colors. I go to the hospital and get an x-ray to double check. It turns out it's worse than I thought. I receive additional treatment and have to pay $2,700 more. Because it's within 90 days of the original injury, they'll count it as a single incident. And now I can submit both bills, $3,200 in total. I haven't had any claims yet this year, so they subtract my $3,000 personal responsibility and send me $200. The main takeaway here is, if you're going to get hurt big. The worst case scenario would be a bunch of separate small to medium case scenarios that cost less than your plan's minimum amount to qualify. The threshold is per incident, but the personal responsibility / deductible is annual. So if later on, within the same 12-month term, I hurt my other ankle, and this time it's a full-blown scataboo, medical bills easily exceed $3,000, and I submit them to CHM and get reimbursed for the full amount because I already met my personal responsibility earlier. On all plans, CHM will reimburse up to $125,000 per illness or incident. But there is an option to pay an additional $42 per month for CHM Plus, which increases the limit in case there are long-term expensive treatments you need to cover. CHM has a few additional perks, including access to free telehealth services via HealthTap, so you can avoid paying for a sick visit. If you have a persistent cough or a weird rash you want a professional to take a look at, you can take care of it virtually, and they can even write you a prescription. Speaking of prescriptions, incident-related prescriptions are covered up to the first 90 days of treatment. After that, you're on your own. But you can use something like GoodRx or Mark Cuban's Cost Plus Drug Company to get discount prescription medication. Samaritan Ministries is similar, but different. Instead of paying your monthly contribution to Samaritan and having them distribute it, you actually send a payment directly to other members. You receive a statement each month with information about another member's need, and you can send them a check or digital payment to them, and often members will include a note of encouragement. Then, on Samaritan's website, members confirm that they sent or received a payment. On one hand, I really like this highly personalized, humanized community approach. But on the other hand, it's a lot more involved than setting up autopay, but that's kind of their point. This will appeal to some folks, but definitely not for everyone. Let's look at their programs. There's Samaritan Basic and Samaritan Classic. Basic costs about $150 per person per month. It varies slightly up or down depending on your age, and it covers 90% of qualifying bills after an individual need exceeds $2,000. Classic costs about $300 per month and covers 100% after a need exceeds $1,000. Similar to CHM, a need can include multiple doctor visits, treatments, follow-ups, etc. And if you get more bills after you sent an initial reimbursement request, you can submit those as well and add them onto the existing need so you're not starting from zero. If you're on Basic, you need to pay a higher initial unshareable amount of $5,000 for maternity-related needs before the 90% co-sharing kicks in. On the Classic plan, you only have to pay $3,000 for maternity needs, and then 100% of the remaining costs are shared. So that's definitely a better pick if you are in baby mode. Both plans cover up to $250,000 per need, but similar to CHM Plus, you can opt in to a program, Samaritan calls it Save to Share, where you pledge to contribute a little more each year, about $133 per person, and you'll be eligible for additional assistance if you ever require prolonged and more costly medical care. Both plans also cover a 120-day initial supply of prescribed medication or supplements. Something to keep in mind, Samaritan and Christian Healthcare Ministries do not cover preventative care, and they'll have a lot of stipulations around pre-existing conditions. They might require a 3 to 12-month waiting period before certain procedures are eligible for coverage. Be sure to read their terms and conditions. They are not insurance. They are not regulated like insurance and are not required to cover everything that a conventional insurance plan covers. But that's why they cost less. That said, Samaritan recently launched a completely separate product that you'll see if you visit their website called Redeem Health Share. And this tracks more closely with the conventional insurance plan and does cover well visits and other preventative care. That's all I'll say about Redeem because it's pretty similar to the next option I want to look at, Unite Health Share Ministries. I actually used UHSM when I first went full-time self-employed because I was hesitant to get a marketplace plan and lose the tax credit, which, hello again. UHSM's offering is now called WeShare, and it looks a lot more like a conventional insurance plan. Instead of CHM's or Samaritan's reimbursement model, medical providers bill UHSM directly. The plan covers annual checkups and screenings. For primary care sick visits, you only have to pay a $25 copay. They call it a consultation fee. $75 copay for specialists, $10 for labs, $75 for x-rays. You can go down the list and see everything that's covered. Then for hospital services or radiology and other more specialized care, you would pay an annual member care share, their term for a deductible, and they cover the rest. The price of the plan depends on the deductible amount. You choose from $1,369 or $12,000. It also depends on your age, if you're a smoker or non-smoker, and there is a healthy lifestyle discount you can apply for as well. They work with the PHCS network, which is, according to their website, the largest independent nationwide primary preferred provider organization, or PPO. They are not an insurance company, but they establish access and negotiate pricing with medical providers. You can search their website to see who is in network, but it seems pretty extensive. My hospital, my primary doctor, my wife's OB, they're all on there. UHSM also partners with CVS Minute Clinic, Amwell, which is a telehealth provider, BetterHelp, CVS Caremark for prescriptions, and Carrington, which sounds like a delightful British teddy bear, but it's actually a dental and vision discount plan provider. They also offer discounts for Noom, HelloFresh, and Gym Network. Lots of value there. Where the previous options are pretty bare bones, UHSM's WeShare program is really robust. But how much will I have to pay for said robustness? For my wife and I, WeShare with a $12K deductible will cost $509 a month. But we can get that down to $424 a month if we apply for the healthy lifestyle discount. To compare, a CHM Silver plan would cost $338 for the two of us, and Samaritan Basic would run $290 a month. I'm still waiting for my state's marketplace to publish their new rates. I crunched some numbers, and I'm expecting my current Silver plan to increase to $680 a month. And one of the cheapest Bronze plans will run about $350 to $400 a month. And that comes with a $8,500 individual deductible and a $75 primary doctor copay. But I'll confirm that as soon as open enrollment begins. In the meantime, this is what I'm going to do. I'm going to simulate a year's worth of expected and unexpected medical expenses and see how much I should expect to pay with each of these options. So let's say my wife and I both get our annual checkups. I get some blood work done, make sure my cholesterol and stuff is okay. I'm turning 40 next year, so 'tis the season for cameras in places. My wife gets her annual OB visit. And for this experiment, let's also tack on a sick visit with some antibiotics prescribed and some sort of injury with a $7,000 price tag when everything is said and done. With insurance, the well visits, blood work, OB, and colonoscopy should be covered. The sick visit will require a $75 copay, $5 for the drugs, and the injury will be out of pocket until I meet my deductible, so the full $7,000. Add the monthly premium times 12, and we're looking at $11,880 for the year. With WeShare, well visits, OB, colonoscopy are covered. Sick visit is $25, blood work is $10, drugs are $10, the injury is $7,000. And let's say we start with the normal rate for the 12K deductible plan at $509, then get approved for the discounted rate for the rest of the year. So that is $1,076.46 in monthly fees for a total of $12,221.46 for the year. About $340 more than insurance. Christian Healthcare Ministry at the Silver plan would not cover well visits, but they would cover telehealth, and a blood pressure cuff costs $30 on Amazon, just saying. But if we want to be thorough, let's say a simple checkup with a cash pay discount runs $100 for each of us. The OB visit will be about $250. The colonoscopy screening would run, let's go with $1,500 after a cash pay discount. The sick visit is free via telehealth, and we can grab the antibiotics for less than $4 with GoodRx. The blood test would be about $80 out of pocket, and the injury would cost no more than $3,000 after reimbursements. So that's $5,034 plus $4,056 for the silver plan fees. Hello, that's $9,090. Not bad. With Samaritan, well visits, OB, colonoscopy, and blood work would be out of pocket again. They don't list telehealth directly in their benefits, but they did mention a partnership with another company that offers $38 virtual visits. So you could use that. $4 for meds. And the injury would cost $2,000 plus 10% of the remaining $5,000. So $2,500 altogether. That's $4,572 for the services and $3,480 in plan costs, totaling $8,052. That's almost $4,000 less than what you'd pay with a bronze plan. So, on paper, Samaritan Ministries looks like the most affordable of the four options we evaluated. But it is the least conventional. It requires more work to submit claims and make payments, and it could take longer than most other options to receive reimbursement, so you need to make sure you have a way to float your healthcare costs while you wait for support. CHM comes in second place for price, but has a more polished and streamlined experience and a longer track record than Samaritan. WeShare by UHSM is actually the most expensive in this scenario. But when you consider the vision and dental discounts and some of the other perks like a free Noom subscription, there's more value you can squeeze out of this. And then there's regular old insurance. Not the cheapest option, but you know what it is. And you can have much more confidence that it's going to cover what you need. Now keep in mind, we only ran through one specific scenario. I cannot stress enough that everything I just went through was make-believe. The costs are estimates, and I have no way of knowing what our actual medical needs will be in the future. But hopefully, this gives you an idea of how some of these alternative options would work and what they would cost. Please run your own numbers and check the fine print to see if any procedures or conditions would be ineligible for cost sharing or if they would require a waiting period. And note any requirements for joining. A lot of health share groups are faith-based and require you to agree to and affirm their beliefs. Do your homework, crunch some numbers, make an informed decision for you and your family. Remember, the best option isn't the same for everyone. It depends on your health, your budget, your risk tolerance, and even your values and beliefs. So what am I going to do? Honestly, I'm still figuring it out. I'm waiting for the actual marketplace numbers to get updated, and I'll have a much better idea. I'll be sure to keep you posted on what I ultimately decide. So be sure to subscribe and follow along. If you found this breakdown helpful, or if you have experience with any of these health share programs, drop a comment below. We're all navigating this together, and your insights could really help someone else. Finally, one massive way to help make healthcare costs more affordable that we didn't talk about yet is to earn more money. That's what this channel is about, launching and growing a sustainable income stream so you can provide for your family and have the freedom and flexibility to spend more time doing what you love with the people you love. If you have a side gig or you're thinking about starting a business, be sure to check out selfemploymentsidekick.com for more helpful resources, and please feel free to reach out. I'd love to have a conversation and learn how I might be able to help you navigate your self-employment journey.